Disclaimer: this video is for informational purposes only and does not replace medical advice. If you have any doubts or specific health conditions, always consult a professional. Hello everyone, and welcome to Health Pills. Today we will talk about a very important topic that can affect your health without you noticing: diabetes. Diabetes is a chronic condition that occurs when the body is unable to properly regulate blood sugar levels. Many people may have diabetes without knowing it because the initial symptoms can be subtle and easily mistaken for other conditions. In this in-depth discussion, we will talk about 20 signs that you might have diabetes without knowing it. Pay attention to each one of them, and if you recognize any of these symptoms, see a doctor immediately. What causes diabetes? Diabetes is caused by problems in the production or use of insulin by the body. In type 1 diabetes, the immune system attacks and destroys the beta cells in the pancreas, which produce insulin that is essential for blood sugar regulation. The exact causes are not entirely clear, but genetic and environmental factors, such as certain viruses, may trigger the disease. In type 2 diabetes, the body becomes resistant to insulin or does not produce enough of it. This type of diabetes is often linked to being overweight, a sedentary lifestyle, and genetic factors. Gestational diabetes occurs during pregnancy due to hormonal changes and insulin resistance, increasing the risk of developing type 2 diabetes in the future. What are the consequences if diabetes is not treated? If diabetes is not treated or properly managed, it can lead to a range of serious and potentially life-threatening complications. Some of the main consequences include cardiovascular diseases. Diabetes increases the risk of heart diseases, such as heart attack and stroke, because high blood sugar levels can damage blood vessels. Diabetic neuropathy. Nerve damage can occur, especially in the legs and feet, causing pain, tingling, numbness, and even loss of sensation, increasing the risk of wounds and infections. Diabetic nephropathy. Kidney damage can lead to kidney failure, requiring dialysis or a kidney transplant. Diabetic retinopathy. Damage to the blood vessels in the eyes can cause vision problems, including blindness. Diabetic foot. Wounds and ulcers on the feet can occur due to poor circulation and neuropathy, potentially leading to amputation if not properly treated. Skin problems. Infections and slow healing are more common in people with diabetes. Pregnancy complications. Women with diabetes may face increased risks of complications during pregnancy that can affect both the mother's and the baby's health. Dental problems. Diabetes increases the risk of gum infections and tooth loss. These complications can often be prevented or minimized with proper management. At the end of this discussion, we will also share tips on how to do this. What tests should I do to identify diabetes early? Early diagnosis of diabetes can be done through blood tests that measure glucose levels. The fasting blood sugar test, oral glucose tolerance test, and glycated hemoglobin (HbA1c) test are some of the tests that can be performed to diagnose diabetes. If you are diagnosed with diabetes, your doctor will recommend a treatment plan that may include lifestyle changes, medication, and regular blood sugar monitoring. Now let's discuss the 20 signs that may indicate the presence of diabetes. Stay until the end because the 18th sign is something that many people experience but few realize could be linked to diabetes. Remember, while these signs may suggest the presence of diabetes, only a healthcare professional can make a definitive diagnosis through specific laboratory tests. Sign 1: excessive thirst. One of the most common signs of diabetes is excessive thirst, also known as polydipsia. When blood sugar levels are high, the kidneys work harder to filter and absorb the excess glucose. When the kidneys can't keep up, the excess glucose is expelled in the urine, leading to fluid loss and dehydration. This causes a constant feeling of thirst, even when drinking large amounts of water. Excessive thirst is often one of the first symptoms people with diabetes notice. The body tries to eliminate the excess sugar in the blood through urination, resulting in frequent dehydration and thirst. This cycle of thirst and urination can be exhausting, especially at night, as it disrupts sleep quality. Chronic dehydration can cause weakness, dizziness, confusion, and in severe cases, hospitalization. If you find yourself drinking more water than usual for no apparent reason, it is important to pay attention and consult a doctor. Sign 2. Frequent urination. Frequent urination, also known as polyuria, is directly related to excessive thirst. When there is an excess of glucose in the blood, the kidneys try to eliminate it through urine, which leads to increased urine production. Consequently, you may feel the need to urinate more often, even at night. Frequent urination can be very uncomfortable, especially if you need to wake up multiple times during the night to go to the bathroom. This can disrupt sleep and negatively impact energy and mood during the day. Additionally, constant fluid loss can lead to dehydration, further increasing the feeling of thirst. While frequent urination can also be caused by other conditions, such as urinary tract infections or prostate issues, if you experience it along with other signs of diabetes, it is important to see a doctor for an evaluation. Sign 3. Excessive hunger. Excessive hunger, or polyphagia, is another common symptom of diabetes. When the body is unable to properly use glucose as an energy source, it sends signals to the brain indicating it needs more food. This can lead to a constant feeling of hunger, even after eating large meals. Polyphagia occurs because, despite high blood glucose levels, the body's cells cannot access this glucose as an energy source due to a lack of insulin or insulin resistance. As a result, the body continues to send hunger signals in an attempt to get the necessary energy. This constant hunger can lead to weight gain, especially if high-calorie foods are consumed to satisfy the appetite. Weight gain, in turn, can worsen insulin resistance, creating a vicious cycle that exacerbates diabetes symptoms. Sign 4. Unexplained weight loss. Unexplained weight loss can be a sign of diabetes, especially in type 1 diabetes. When the body cannot obtain energy from glucose, it starts burning fat and muscle for energy, leading to rapid and unexpected weight loss even if the person eats normally. In type 1 diabetes, the body does not produce enough insulin, while in type 2 diabetes, the body may not use insulin properly. In both cases, the cells cannot absorb glucose from the blood as an energy source. To compensate, the body starts breaking down fat and muscle stores, causing weight loss. If you are losing weight without changing your diet or activity level, it is important to consult a doctor to investigate the cause. Sign 5. Fatigue. Fatigue is a common symptom of many health conditions, including diabetes. When the body cannot properly use glucose, it lacks the energy needed to function, causing a constant feeling of tiredness and lack of energy, even after a full night's sleep. Fatigue in diabetes is caused by the inability of cells to obtain glucose from the blood for energy production. This can be due to a lack of insulin, insulin resistance, or a combination of both. Additionally, dehydration from frequent urination can contribute to fatigue. Fatigue can significantly impact daily life, making it difficult to complete tasks or engage in activities that are normally enjoyable. If you feel constantly tired for no obvious reason, it's worth seeking medical help. Sign 6. Blurred vision. Blurred vision is another common symptom of diabetes. High blood sugar levels can cause swelling in the lenses of the eyes, impairing the ability to focus. In some cases, blurred vision can be temporary, but if left untreated, it can lead to more severe complications such as diabetic retinopathy. Blurred vision can occur in both types of diabetes and is often one of the first signs people notice. Elevated glucose levels can accumulate in the lenses of the eyes, causing swelling and distorted vision. Controlling blood sugar levels can improve blurred vision, but if glucose remains high for too long, it can permanently damage the blood vessels in the retina, leading to vision loss. Sign 7. Slow healing. Slow healing of wounds and cuts can be a sign of diabetes. High blood sugar levels can damage nerves and blood vessels, impairing circulation and making it difficult for wounds to heal. This can lead to infections and more severe complications if not properly treated. Slow healing is a common problem in people with diabetes and can affect both small and large wounds. High blood glucose levels can impair the function of immune cells, making it harder for the body to fight infections and heal wounds. This is particularly common in the feet, where blood flow may be more limited. Sign 8. Frequent infections. Frequent infections, especially urinary and skin infections, can be a sign of diabetes. High blood sugar levels create an environment that favors the growth of bacteria and fungi, increasing the risk of infections. Urinary infections are common in people with diabetes because elevated glucose in the urine encourages bacterial growth. Symptoms of a urinary tract infection can include frequent urination, pain or burning during urination, and cloudy or strong-smelling urine. Additionally, skin infections such as boils and abscesses are more common in people with diabetes. Sign 9. Dry skin and itching. Dry skin and itching can also be symptoms of diabetes. Dehydration caused by frequent urination can lead to dry skin, while circulatory problems can affect skin health, causing itching and infections. Cirrhosis, or dry skin, is common in people with diabetes and can be exacerbated by hot baths, harsh soaps, and low humidity in the air. Dry skin can cause flaking, cracking, and a feeling of tightness, increasing the risk of infection. Itching can also be caused by diabetic neuropathy, a condition in which nerves are damaged due to high blood sugar levels. Sign 10. Tingling and numbness. Tingling and numbness, especially in the hands and feet, can be a sign of diabetic neuropathy. Over time, high blood sugar levels can damage nerves, causing sensations of tingling, numbness, or pain in the extremities. Peripheral neuropathy, which affects the hands and feet, is the most common form of neuropathy in diabetes. It can cause pain, tingling, numbness, and muscle weakness. Neuropathy can also affect the autonomic nervous system, leading to digestive, bladder, and erectile dysfunction issues. Sign 11. Dark patches on the skin. Dark patches on the skin, especially in folds like the armpits and neck, may indicate insulin resistance, a precursor to type 2 diabetes. This condition is known as acanthosis nigricans and signals high insulin levels in the body. Acanthosis nigricans causes dark, velvety patches on the skin that can be uncomfortable or unsightly. These patches are more common in areas where the skin folds or rubs together. Although acanthosis nigricans does not cause symptoms other than changes in skin appearance, it is an important signal that the body is struggling to regulate blood glucose levels. Sign 12. Mood changes. Mood changes, such as irritability and sudden mood swings, can be a symptom of diabetes. The body's inability to use glucose as energy, along with hormonal imbalances, can affect mood and emotional well-being. Hyperglycemia, high blood sugar, can cause irritability, anxiety, and depression, while hypoglycemia, low blood sugar, can lead to nervousness, confusion, agitation, and mood swings. These changes can be difficult for both the person with diabetes and their loved ones to manage. Sign 13. Oral infections. Oral infections, such as gingivitis and periodontitis, are more common in people with diabetes. High blood sugar levels increase the growth of bacteria in the mouth, increasing the risk of gum and tooth infections. Diabetes can affect oral health due to high glucose levels in saliva, which promotes bacterial growth. Gingivitis, an inflammation of the gums, can cause redness, swelling, and bleeding. If left untreated, it can progress to periodontitis, a more serious infection that can damage the tissues and bones that support the teeth. Sign 14, inflamed gums. Red, swollen, and sensitive gums can also be a sign of diabetes. Diabetes weakens the body's ability to fight infections, making gum problems more likely. Gum inflammation, or gingivitis, is often the first stage of periodontal disease. If left untreated, it can develop into periodontitis, causing damage to the bones and tissues that support the teeth. This can lead to tooth loss and other oral complications. Sign 15, nausea and vomiting. Frequent nausea and vomiting can be a sign of diabetes, especially if associated with other symptoms such as excessive thirst and frequent urination. These symptoms can be caused by high blood sugar levels and diabetic ketoacidosis, a serious complication of diabetes. Diabetic ketoacidosis occurs when the body begins to break down fats for energy because it cannot use glucose. This process produces ketones, which are acids that can accumulate in the blood, causing nausea, vomiting, abdominal pain, and confusion. Sign 16, dry mouth. Dry mouth, or xerostomia, can be another symptom of diabetes. Dehydration caused by frequent urination can lead to insufficient saliva production, causing a constant feeling of dryness in the mouth. Dry mouth can be uncomfortable and increase the risk of oral problems such as cavities, gingivitis, and infections. Saliva helps protect teeth from decay and facilitates chewing and swallowing. Sign 17, bleeding gums. Bleeding gums can also be a sign of diabetes. High blood sugar levels can affect gum health, making them more susceptible to infections and bleeding. Bleeding gums can occur during brushing or flossing and are often a sign of gingivitis. If not treated, gingivitis can develop into periodontitis, a more severe condition that can cause tissue and bone damage that support the teeth. Sign 18, difficulty concentrating. Difficulty concentrating can be a symptom of diabetes. Blood sugar imbalances and a lack of energy can affect brain function, leading to concentration and memory problems. Both hyperglycemia and hypoglycemia can cause neurological symptoms, including difficulty concentrating, confusion, dizziness, and blurred vision. These symptoms can affect daily activities, work, and social relationships. Sign 19, frequent headaches. Frequent headaches can be another sign of diabetes. High blood sugar levels can lead to dehydration and changes in blood vessels that can trigger headaches. Sign 20, unexplained weight gain. Unexplained weight gain, especially in the abdominal area, can be a sign of type 2 diabetes. Insulin resistance leads to fat accumulation, particularly around the waist. How to avoid diabetes. These are the 20 signs that may indicate you have diabetes without knowing it. If you recognize one or more of these symptoms, it is essential to consult a doctor for a full evaluation. This includes a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, along with regular physical activity and maintaining a healthy weight. How is diabetes treated? In addition to lifestyle changes, diabetes treatment may include oral medications or insulin. There are various types of diabetes medications, each working in different ways to help control blood sugar levels. Regular monitoring of blood glucose levels is essential for managing diabetes. This can be done with a home glucose meter that allows you to measure sugar levels multiple times a day. Managing diabetes also means controlling other health conditions that may be affected by diabetes, such as high blood pressure and high cholesterol. Conclusion: proper diabetes management and education can prevent serious complications, improving overall health and quality of life significantly. Participating in diabetes education programs can help you learn more about the disease, how to manage it, and how to make healthy lifestyle choices. Health professionals such as doctors, nurses, and nutritionists can provide this education. Emotional support is also crucial for people with diabetes. Living with a chronic illness can be challenging and impact mental and emotional health. Additionally, it is important to have regular medical checkups to monitor possible diabetes complications. These may include blood and urine tests, eye exams, foot exams, and kidney function tests. If you have been diagnosed with diabetes, it is essential to follow the treatment plan recommended by your doctor and make the necessary lifestyle changes to manage the disease. Thank you for watching Healthy Pills. If you found this video helpful and want more tips on improving your health, be sure to subscribe to the channel. Leave a like and hit the notification bell so you never miss out on our latest updates. See you soon!